Hello and welcome everyone. Today we'll be discussing how to start doing a research, how to go from bedside to the bench to do or start any kind of a research inside the ICU. This is a very simplified guide for the future intensivists and people who are trying to start doing research now or something like that. So this will be a very simplistic guide. Each aspect can be discussed in more details. If you want, I can make more videos on those aspects. Regarding the first thing, how do we actually identify our research topic? This is a very common problem or confusion that people have, or a inertia that they have, that what topic they should do. This becomes a major problem because they never find a topic, they don't understand what the topics can be. They believe it has to be an RCT comparing two treatments, and that treatment has to provide some mortality benefit, then only they can do a particular study. So these things are a major hindrance in their future research prospects. So you will see all the major topics that have been published, they often begin with just simple keen observation and critical thinking during your rounds. So it is your rounds, the daily clinical practice that you do, which identifies the topics for you. So start with your daily ICU practice. See what things are challenging you, what unexpected patient responses you have seen, what current protocol are looking to be inefficient. This is something you will encounter day in and day out. So you have to reflect on these challenges and inefficiencies and try to make some intervention to overcome it. So look for unusual patterns and outcomes, pay attention to anomalies. Is a particular treatment yielding inconsistent results? Are particular demographic experiencing different outcomes than expected? Something like that. Now, also there will be gaps in your evidence. You may not be finding evidence for something that you are doing. You may not be finding the exact lines in the guidelines which you are doing day in and day out. That means there is no active research in those fields. So you have to identify those things. You have to find the medical literature which is inconclusive, guidelines which are ambiguous, which are based on expert opinion, where there is lack of a robust evidence to support your daily common practice. This is fine. This is everywhere in the ICU. Most of the areas will be like this only. So there is abundance of topic for research inside the ICU. So what are the tools to spot these topics? So finding compelling research question requires leveraging various resources and opportunities you get. The resources like literature, books, opportunities are your daily clinical practice. So the most important will always remain your bedside observation. You directly observe in your patients to find what are their clinical problems, the areas, the treatment areas where there are uncertainties, where there is uncertainty in the responses which warrant more research. You will go to conferences, you will have journal clubs in your center, where if you actively participate in the forums, you will understand where are the gaps, what are the new methodologies of research we are doing, what new research topics can be found. It is abundant in the discussions you will see every conference. Next is mentor suggestion. Every person should have a mentor, especially if you are in a junior level. So always go to your mentor with these ideas and try to discuss with them what could be the most promising area where I could be doing the research, because thinking something is totally different from actually doing it. As a resident, you may find a lot of things important, which obviously with experience your mentor knows probably isn't that important, and probably that particular research will not be feasible. So you must discuss with people who have expertise. If you're working alone, then consult the people, other experts in the field. Go and join with some ongoing projects so you can understand how the question is evolving, how the data is collected, and of course by discussing your challenges with your mentor. Now, there are also various tools which are available now. This must be understood. That is, there are a lot of places where, apart from your clinical research, you can get a lot of powerful databases. That is, there are large ICU databases which are available, like Mimic 4, like EICU. They give you comprehensive de-identified patient information. This is extensive information of thousands and thousands of patients. So you can think of something and start your analysis. Nearly 1,000+ topics from Mimic are already published in PubMed. There are biobanks, like vast collections of clinical biological samples where you can explore the genetic, molecular, and cellular insights into the clinical illness. Finally, you have AI, big data analytics, where you leverage artificial intelligence to identify complex pattern in your data that you have been collecting for the last, say, 4 to 5 years. So you need to understand how you can build up that data analysis, how AI will help you. But if you have any kind of a data over the last 4 5 years, you can do pretty good AI analysis through them. Now, next, once that you have decided what your question is, your next job would be to refine this question. So, how would you do that? Next is, why does this happen? If you have to find a problem. Now, I have found this problem. Why does this problem happen? Shift from mere observing the problem to thinking why it is happening. Delve into the underlying mechanisms. Why is the patient having delirium? What are the contributing factors? What are the consequences of the phenomenon you have noticed? This will help you formulate a problem, because delirium will have multifactorial things and you can't target everything. So you have to understand which particular aspect are you trying to reduce the risk factors, are you working on the treatment, or you're looking at the impact of delirium on the outcome. There are various aspects. This is just an example. Similarly, you can do it for every problem that you face in the ICU. Next, convert what if you have thought into a testable hypothesis. Every research must have a good and framed hypothesis, a proposed explanation or prediction that can be scientifically investigated, and ensure it includes clear variables and an anticipated relation. You clearly say that by looking for delirium, I am looking at the 6 months quality of life or something like that. So your outcomes must be very clearly defined. 6 months quality of life, correlating it with a delirium diagnosis. So keep it focused and measurable. Just thinking that I will do something is not going to work. Narrow down your question to a very specific scope: risk factor, management, outcome, anything. Define your outcomes very clearly. Identify how will you measure. This is very important. Just don't leave everything. Mortality can be ICU mortality, can be 28-day all-cause mortality, can be hospital mortality, can be 90-day all-cause mortality. Everything 60 days, 1 year, you can take anything. So that is going to be main factor. Identify how will you measure it. Avoid overly broad or a vague question that is difficult to answer with empirical data. Don't just put any question. Why does delirium happen? It is going to be very difficult for you to understand how will delirium happen, and you will never be able to answer that question if you are going for that vague question. So focus your question, make clear correlation between the what you're testing and the outcome you're testing, define your outcomes, know how you will measure those outcomes. Next is, once you have your hypothesis, you need to do a literature search. You have to establish that this actually problem which is existing, and this is the outcome you should be measuring. So this is going to be a vital part. Now, this will obviously will require a more detailed video. I'm not going to extreme details because it will make the video unnecessarily lengthy. Literature search is vitally important. Avoid duplication when you are doing this. So ensure your research addresses new questions and doesn't just really replicate a previously done study. It is not going to work out if you're doing the same thing all over again. Don't just go around and randomly replicate any particular study. This will save you valuable time and resource, because once you've spent 3 4 years for Doing a research which has already been done, it's not going to make anything good. Now, what is already known, make a list of that, what we know already, and then identify the knowledge gaps. And it is those knowledge gaps which you need to target. Now, how do we do the literature review and the tools? I will give you some very basic things like there are databases which you need to search, like PubMed, Scopus. Google Scholar is not considered a very robust area where you can do scientific research, but you can use it if you're doing some extensive meta-analysis or something like that. There are other AI powered tools which are available like Litmap, Connected Paper, Research Rabbit, and Elicit. Personally, I use Litmap, and it does help you a lot in finding out related topics. Regarding reference management, once you have got these references, you need to know how to manage it. This is vitally important. There are some free tools available like Zotero and Mendeley, but there is also paid one available, that is EndNote. But for all practical purposes, I would request to go with Zotero. But you must learn reference management. Without reference management knowledge, there is just not possible to do a research in the current times. There is just too many papers, too many journals, and it's going to be extremely difficult. And do make a summary table of what key findings you're trying to look for and what already is known. Next, define your study. Choose the outcome. Select appropriate outcomes. This is going to be very important. You thought you will do something, but not necessarily it will remain the same after the literature review. You may find those questions have been answered, so you need to find something new, or there must be some new area that you have identified. So go for a primary outcome. This is going to be the single most important question of your study. So primary outcome must be something which you absolutely understand everything about. It must be very specific with a proper definition. It must be measurable, and it should directly address what you are discussing in your hypothesis. I cannot just say that how does delirium happen and then go and measure mortality. Come on, it doesn't make any sense. It's not going to work like that. Secondary outcomes, there is additional measures which will help you support your findings. Now, all chosen outcomes must be clinically relevant for patient care. This is going to be important because this is what the reviewers are going to see. And they will obviously see whether it is objectively measured or there are subjective elements to it. If you are including subjective elements, it is going to make your study more poor than an objectively measured outcome, and ensure the validity of what you're testing. You cannot just make a random score and start testing. You have to ensure that it is valid, previously been used, and of course, then only your research finding will have some utility. Now, example of some of the outcomes, the most common one being mortality. I won't go into the details. This is going to be very important. Each item must be clearly discussed. Ventilator-free days, the definitions are going to be the key. Organ refailure function, these are some of the common outcomes that we use in our ICU studies. So, choosing the right study design is going to be crucial now. Now that I have done my literature review, I have done my hypothesis and everything is done. How do I do it? There are multiple ways. The best way to start to identify a problem would be a retrospective study, because it is quick data collection, low research demand, and it is basically exploratory. You're trying to find out what are the possible causes of delirium. But obviously it is going to be much low in terms of publication capacities. A prospective study is more important and more better because it is going to be more strong evidence, less bias, but it will require more resources from you. But the data quality improves. And finally, you must intervene to change some outcome. Otherwise, what was the point of identifying the problem? Now that you have identified the problem, you have to intervene and do something about it. Now, that is best done with RCT, and it is the highest level of evidence. It is the one which has the least bias, but it is resource heavy. It is not that you can't just do a RCT just like that. Understand the resource requirements is going to be very, very important. Now, careful planning is the bedrock of robust research. Before initiating data collections, these foundation steps ensure your study is well structured, unbiased, and capable of yielding meaningful results. So you must have very important The population definition is important. This is the most critical step. Inclusion and exclusion criteria. This must be clearly defined, and it will define what population you are testing it on. Predefine all variables that you're going to record. When are you measuring the CAM ICU? When are you measuring the heart rate? Everything must be clearly defined. And next, once you have done everything, develop your protocol. Next, the role of stats. It is going to be very important. Plan your test beforehand, before you collect all data. Don't just think that I will do the data analysis later. No, it's not how it works. You have to do your data collection. Before that, you must have all your tests planned. Discuss it with your statistician and avoid data fishing. Resist the temptation to continuously search for significant results by repeatedly analyzing data. This is very easily spotted. Don't try to do this. Essential before you start: ethics approval, which is mandatory, funding and grants if you're requiring large resources, and of course, you need to have a good research team. Now, AI in research is going to help a lot. It's primarily used in finding a data pattern, doing the literature synthesis, and developing a protocol. Now, where AI cannot replace you is your clinical judge. It cannot just make a topic up for you. You have to do it. It cannot design meaningful questions for you. And ethical oversight and patient focus is important. You cannot fabricate anything and just do it with AI. It will be easily spotted. Next, writing your study. Use the IMRAD structure: introduction, method, result, and discussion. Be concise and clear. Use plain language. Structure sentences with clarity. Avoid redundancy. Here you can take the help of AI. You have PaperPal, Grammarly. You can use both of them because Grammarly does a little more grammar corrections. If you're not from a natural English speaking population, you would need these things for a good journal publication. Now, highlight ICU relevance in your study, which is going to be vital. Next would be choosing a journal. Don't think that you will start with any journal. You cannot just do that. See your study, look at the publication capabilities, choose your impact factor like that. Match your scope and niche, find the proper journal, evaluate the impact and the audience. Then, of course, if you have funds, you can go for open access, or it would be better to go for subscription. Now, you can present your work, like you can submit your abstracts and poster presentations and oral sessions in conferences. So just putting it all together: first identify your topic, then refine your question, do a literature search, find your gaps. Now define your outcomes, choose your study design, plan your methods and stats, then ethics and funding, finally the study, which is the most important part, and finally writing and publishing. So in ICU, every unanswered question in the rounds is an opportunity for discovery. I hope it was helpful. Thank you.